Hey, good morning. It's Marva again, and the storyteller. I want to tell you a story today that I hope will help you to live a very healthy and happy life. I want to remind you also that your health is your wealth, and also that your food is your medicine, and your medicine is your food. Some years ago, maybe probably 15, 16 years ago, while working in the hospital, I had a patient from Trinidad. This lady was about 60 years old. And we got to talking. I love to talk with my patients. And she told me that her husband had died in his late 50s. And that he had died from liver failure. So, of course, I wanted to know why. I automatically assumed that this man was an alcoholic or had hepatitis of some sort. And she said no. The gentleman was diagnosed with high cholesterol, hyperlipidemia, and they had put him on a cholesterol drug. I believe it was Lipitor, she said. And he subsequently went into liver failure as a side effect from the drug and died from the liver failure. At that time, I wasn't deeply into researching nutrition. I really believed in the conventional Western way of treating diseases and disorders. So it stayed with me. It's almost 20 years now. But that was kind of it. After that, my own husband was diagnosed with high cholesterol. And the main reason was that my husband ate whatever he wanted to eat, junk, a lot of meat. At that time, I wasn't big into the nutrition as I am right now, so I tried my best to provide healthy meals for my family. But I kind of didn't know. I was ignorant. I didn't know a lot of things, so I continued to buy the juices. I never bought sodas. We ate bread, we ate rice, and we ate meat every day. A very Caribbean diet. And my husband also, he lacked discipline, so he ate a lot of junk, put it that way. And so did my son. They would go out and they would buy McDonald's and they would buy all kind of fast foods, and that's what my husband was giving to our son, and that's what my husband was eating himself. So my husband subsequently was diagnosed with high cholesterol. His total cholesterol was over 200, well, put it that way. His total cholesterol was 550 when he was first diagnosed. And I think most people know now that anything under 200 is acceptable by the medical society. And his triglyceride was over 700. Normal triglyceride is 150 or less. So, of course, his doctor put him on Lipitor. My husband's doctor put him on Lipitor. And he started having severe muscle pain. He was weak, his urine was dark, and he had no energy, lethargic all the time, even confusion. And took him to the doctor, and they did nothing. And I never even thought of looking up the side effects for this cholesterol drug. And took him back to the doctor, just kept taking. So they switched him from Lipitor to Crestor, which the side effects are really the same. And they did some blood tests, and sure enough, my husband's liver function test, his AST, ALT, which measure the SGOT, which measure the function of the liver, were through the roof, extremely high. So this guy was actually going into liver failure. Well, you would think that these doctors would take him off this drug. No, they did not. So I decided to take him to a medical doctor who also believes in alternative treatments. And this medical doctor is also a nephrologist. And he took him off all the cholesterol drug and told him that he should never ever take any cholesterol drug again in his life. And actually what he did, he put him on high dose of fish oil. I think he was on like, split up throughout the day, 10,000 milligrams of fish oil. And he also put him on vitamin D3 supplement. He told him to, of course, eat healthy, and told him to take kelp supplement because he also had thyroid problems. Now, that's another thing that most doctors don't take into consideration. If someone has thyroid issues and is on thyroid medication, they should really not be on cholesterol drug, which is what this nephrologist told us. But I wasn't into a lot of research then, so I didn't know. And the long and short of it is that my husband, he continued to eat bad. He has had multiple heart attacks. A young man has had multiple heart attacks, kidney failure, has had liver failure, and uncontrolled diabetes, uncontrolled thyroid function, has had open heart surgery, and all of this because he does not eat properly. He eats whatever he feels like eating, whenever he feels like eating it. I want to tell you about some of the side effects of Lipitor, or so-called cholesterol lowering drug. Confusion and memory loss. Okay, it also can lead to liver failure. You'll get jaundice, weakness, muscle weakness. It can lead to kidney failure, so you'll get dark urine, decreased urine output, thirst, and those are just a few of the side effects. Most people don't ever read the side effects of their drug, but I know in the nursing industry, one of the things that we are required to do is to provide our patients with the side effects of the drugs, and they have a choice whether or not to take it. That's protocol at all hospitals. You must discuss side effects. So whatever drugs you are on, I strongly encourage you to read the side effects. Question your doctor. And I know based on experience that if you eat a healthy plant-based diet and exercise and decrease your stress level, it is highly unlikely that you will have any high cholesterol issue. My son, before he got to 10 years old, had high cholesterol. I mean, very high cholesterol level. The doctors didn't put him on any cholesterol drug, fortunately, because those days I probably would have given it to my son. I didn't know any differently. Now I know better. But my son was overweight for a long time. When he got to 16, and I guess he wanted to impress the girls, he started eating properly and exercise, and my son is a lean, beautiful young man. He's vegan, doesn't eat meat, doesn't even eat fish. He's very energetic and strong, and perfectly healthy because of nutrition and physical activity. He exercises and was able to reverse that cholesterol issue. So high cholesterol is directly related to what we eat. Mainly animal-based diet will definitely lead to high cholesterol issues. Okay, so you can reverse high cholesterol with proper nutrition and exercise, primarily a plant-based diet. Yesterday I was listening to Dr. Furman doing a lecture on health and wellness, and he said we really should not be having any more than 7% of our meal, 7%, no more than 7% of our meal should be animal product. That means 93% of our diet should be plant-based diet. And I agree 100%. So remember, every drug has many, many negative side effects. Become familiar with the side effects of your drugs. Question your doctor about these drugs you're on. Okay? And implement a healthy lifestyle. Do a primarily plant-based diet. Exercise. If you do that, you will lose weight if you're overweight. Get adequate amount of sleep. I would say a minimum of 8 hours of good sleep. Decrease your stress level, and you will end up with a healthier body and be able to get off these drugs. First of all, if you do these things, your blood pressure will stabilize and your doctor will take you off blood pressure medicines. If you do these things, your cholesterol level will normalize and your doctor will take you off cholesterol medicine. If you do these things, you will lose weight, your blood sugar will stabilize, and 10 chances to 1 your doctor will take you off diabetes drugs, which they themselves have tons of side effects. Metformin, which is one of those drugs that a lot of doctors prescribe for people with diabetes, metformin adversely affects your kidney. I know of people who go into kidney failure being on metformin. Tons of negative side effects. So I encourage you, take care of your health. Your health should be your first priority. You are your best doctor. And food is your medicine, and your medicine is your food. Who said that? Hippocrates, who is called the father of medicine hundreds of years ago. He also said, walking is man's best medicine. And I agree with him. I have implemented these things I'm suggesting to you. I am 56 years old and I have absolutely no health issues. No blood pressure, no cholesterol, no diabetes, no health issues, no anxiety, no depression, nothing. I'm a healthy, happy, content, robust, energetic 56-year-old, and I'm proud to say that I am. So take care of yourself. You only have one body. You take care of yourself. Okay? Till we meet again, God bless you and have a wonderful day.